reason why Helen is going to speak, why it's so important that she speaks now, is that this is affecting patients now. Helen on the line, I'll leave her to speak about what's happening, but we are not just talking about words on slides and theoreticals. We're talking about people who are in this situation, confronted with some of these things in their lives right now. So please,
I co-founded the Big Opt-Out in 2006 with Bill Booth and with help from Professor Ross Anderson, primarily because I tried to opt out of the summary care record and I found I couldn't. And I worked in the NHS then for over 20 years, and I was horrified to find out where the data was going. I didn't know, and I was frontline dealing with patients every single day. And so we set up the advice line for patients, because if NHS staff don't know what's happening to the data, then the general public don't stand a chance. As you've heard from the talks today, there's a huge number of different NHS databases that all interlink in one way or another to each other. So the advice line offers advice and support on all aspects of NHS confidentiality and consent. We actually deal with specific patient issues. We've got one lady up north at the moment who's very worried about GPAS, and she has got a potential cancer diagnosis and don't go and see her GP. We went out with another patient to see his GP and a director of informatics from their old PCT, now the CCG, a couple of weeks ago too. So there are patients with real issues. Some patients are concerned with one particular aspect, so the summary care record, or they're concerned about their records being hosted on GP systems, or they're concerned about GPS. We can advise on the whole range of databases, and we will give individual support, sometimes over a period of years. The case was talked about earlier, the lady with the broken arm we've been speaking to for 2 or 3 years now. The line is either staffed by myself or another primary care manager, and we also have volunteers who are nurses. So primarily it's run by people with direct NHS frontline patient experience. And we also do some campaigning, but I have to say that the patients take up most of the time. We're open Monday to Friday 9 to 5. You can phone or email. You can contact us anonymously. If you leave your number, once we've dealt with your query, it's destroyed. So we totally respect confidentiality. I think that's about it. Does anyone have any questions?
Find out about you.
We've got the website, www.bigoptout.org. There's little slips on the table with our telephone number and email address. We're happy to deal with email queries. So, however you'd like to contact us.
Net Confidential works with a whole bunch of organisations.
Yeah.
So we'll be passing patient queries, patient inquiries in Helen's direction. So, as you said, she is in a position and her colleagues are in a position to offer support to patients. We are campaigners. Yes, it's very clear. We're not offering ourselves and saying we're doing something. We only work with people who've got capacity and knowledge to be able to do that.
Have any patients yet been refused care because they've opted out or want to opt out?
Now that's a difficult question to answer. It depends which database they're concerned about. We've got one one gentleman who went out to see his GP with him, he's concerned about all the databases, so ultimately he may have a problem with accessing care. But it's very much dependent on the database. The Secondary User Service database, which is a GPAS equivalent for hospital records, it extracts all your hospital records. I found when I tried to opt out of that, even though Section 10 of the Data Protection Act was agreed to apply to me across the whole NHS, I don't even have an NHS number, and Patricia Hewitt agreed it. And the very, very senior civil servants at the Department of Health have effectively denied me hospital care. Unless I go back on the Secondary User Service database, I cannot access hospital care. So it really is dependent on the database. It's also dependent upon things like what your individual GP is prepared to do for you. And if you want to access care anonymously, we can give advice on how to register as a temporary patient or as an emergency patient, or how to use a walk-in centre and use that service anonymously. Because you can legally use any name you want to access NHS care, and we have had that in an email from the Department of Health. So you're doing nothing wrong if you access NHS care in another name. So we can help you, we can advise on that, so it's very much patient specific. And then we do general opt-out letters for summary care record, and we're doing one for GPAS shortly. So, we do the general opt-out letters as well as the very specific individual support.
Did your man actually, was he refused care, or did his GP agree to continue giving you
We
care?
haven't got that far yet, that's still very much ongoing.
Right, well, if there's no more questions and you feel happy
Yeah.
done it, I think we'll lead into lunch. So it's been a very full morning.